So it's now my pleasure to introduce Laura Peltonen, and Laura is going to speak on digital innovations to support nursing care of pediatric endocrine disorders. Laura, over to you.
Okay, thank you very much for the opportunity to be here today to talk about how the digital innovations have been developed and applied into support also nurses in the care of pediatric endocrine disorders. And let's see if I'm able to change slide here. Here we go. Okay, so just jumped 2 slides there. So this is my disclosure, academic, no conflicts of interest here at my end today. And then to the objectives. So I think it would be good to start with an understanding of what digital tools have been developed and applied into nursing care. Also, what the role of the nurses are in this space and how they can be involved in the development and implementation processes of these tools. And then finally, also to have an understanding of the role and impact of these tools, in particular on the nursing care, their work and the processes, but also on patient outcomes. So that's in short for the outcomes, objectives, sorry. Okay, so to provide some context here, I thought it would be good to think about the nursing process, the work of the nurses, to be able to see where these technologies would be very useful, what we have now and also what we need to develop in the future. So nurses are very much involved with the patients and the families. They are there almost all the time. They have a key role in assessing vital signs or lab values, growth patterns or development of these patients. And they also build trust with the patient and the families towards care, which helps also adherence and commitment. They have a very important role in the education of these patients and their families in terms of what these conditions are and how the care and treatment is going to be organized and help them administer therapies, hormone therapies, help with the titration of medication based on the physician's orders and so forth. But they also have a very important role in ensuring that the technologies that we implement actually work as they should be working, so there won't be any problems or such with those. They also provide support and counseling. This psychosocial support is very important in these long-term conditions, and the nurses play a very important role with that. But they liaise with different healthcare professionals between the family, the patient, the child itself, and specialists, coordinate care between different specialists to ensure that the sort of care process is seamless and functions well, effective. So in this space where the nurses help the families navigate the complexities of the health system, we have ample opportunities to apply digital innovations to support the workflow processes, also for the patient care on a broader scale. So this is what we'll be talking about today. Okay, sorry for that. Okay, here we go. So challenges related to the implementation of technologies in pediatric endocrine care, but also challenges overall in this setting are related to, of course, the global lack of healthcare workforce, and that, of course, will display itself also in this specific context. But there's also a challenge with recruitment, retention of skilled professionals. This is a space where we need high competence to have safe and effective care provision. And in terms of the complexities of these long-term conditions, we definitely need support there, need support to help the children and their families to take be empowered to manage the treatment, the care, but also to adhere to the treatment and hang in there in this very long treatment periods, but also in the transition phases when children become adults and when children become adolescents and adolescents become adults. So these transition phases themselves are quite challenging for both the children and their families. So as a burden on families, regular visits, a lot of extra effort needed for the family, but also the healthcare services that sort of challenge these care processes. And then an added, and maybe most in this context in terms of innovation and digital solutions, the data management is not optimal all over. So we have severe challenges in the sort of interoperability between systems and collecting and using the data in a smart and efficient way. So next, here we go. Current trends in healthcare, digitalization, move towards electronic health records, documentation support, these sort of things really help us manage the data that we collect and help us share that data between healthcare team professionals, helps improve care processes. Telehealth solutions, nurses have taken a role in connecting with patients, providing counseling, follow-up, these meetings with patients and their families, so very useful. Remote monitoring, I'll be talking about those a bit later as well. Wearable devices, Internet of Things, these sort of technologies. And of course, AI, that's a very, very recent trend. Everybody's into AI currently. And we really like to have AI applied into healthcare using EHR data to help us identify and predict, provide solutions, decision support to our clinicians. So that's a lot of ample opportunities there, but still altogether in this sphere and this space, in terms of growth hormone therapy, I think the evidence of these technologies is still in its very early phase. So we don't have ample research, ample randomized controlled trials to give us sort of evidence of effectiveness. But we have a lot of transferable information that we can learn from and help us guide the choices that we do. And I think in terms of benefits to nursing, we have evidence also in this context to support that these technologies are able to reduce the administrative burden of the nurses with documentation. You don't need to document the same things in many places, and then something becomes automatic, and you have better access to information, to real-time information, which helps you as a nurse to provide better and personalized care plans, take into consideration the specific needs of the individual there. Also, that would improve your evidence-based practice when you know the current situation, base your decisions on that. But these technologies also have provided means to better support patient education and help families also understand the situation, the current situation of the patient, what the disorder is about, how it's being treated, and all of this sort of understanding, building that understanding will help these families and the patients themselves to commit to care and adhere to the treatment. Okay, so let's see, next slide. Sorry, there's a short delay with me pressing the button and the slide moving. Okay, so in terms of what role nurses have in this space, so the role of all clinicians or all health professionals is changing, and now I'm just talking about the nurses, but this could also be applied to other health professionals. When applying technologies into healthcare, we need to understand two things. First, how the technology works, but then how healthcare works. So an integration between these two spheres is very important here. And the role of the clinician and the nurse in this context has really transformed. So nurses are coordinating, they are educating, and they are surveilling the use and function of these technologies. So that's super important in terms of delivering safe and efficient healthcare services. So keeping that in mind, it's super important that our clinicians, our nurses they understand how these technologies work. They understand the relationship between the data which is being collected and how that will be applied in these technologies. So in terms of AI development, for example, so the input data quality will obviously influence the output decision, which is provided by an AI tool or a decision support system or a predictive algorithm. So these things need to be clear also to the users of the technologies, that they understand how they function. But also we need to have people engaged in the development processes. So it's not sufficient that we engage end users, the patients or the families or the healthcare professionals at the end when the sort of technology is being tested. We need to have these end users involved in the early phases of the technological development, so that we develop tools which are relevant for clinical practice, but also that they are functionable and user-friendly from all the users' perspective. So there's like no one-size-fits-all solution, but actually that they would support the different users' needs. And keeping that in mind, important to maybe also highlight that not everybody needs to understand and know everything, but we need to have someone in this space to take leadership of this kind of technological development and application implementation into healthcare practice. So we need to ensure that our systems have sufficient infrastructure to sort of understand how to apply these. Okay. Here we go. So in terms of what kind of innovations have been applied into pediatric endocrine nursing, telehealth, as I said, very important nowadays after the pandemic. Digital tools have evolved quite a lot. Useful evidence to support e-coaching, for example, different types of solutions for that, from web pages to interactive different systems, online tools. Then we have the remote monitoring wearable devices, which also very, very handy in terms of for example, real-time tracking of markers and vital signs. But also in combination, these different types of technologies become more powerful. So we can have separate technologies, or we can have a combination of technologies. And I think in this space, talking about growth hormone therapy, one interesting study also I was involved with relates to this digital health ecosystem, which sort of combines both like remote monitoring devices, mobile health applications, integration to clinicians and electronic health records. So it has sort of components for administering growth hormone. It sort of collects information about the dosage and the timing of the injection, transfers that to the healthcare professional, helps healthcare professionals and patients and their families stay up to date about how this dose and timing treatment has been realized. Also, there's an added component on educating with some AR, augmented reality components on supporting the children to learn how to do this, how to use this injection device and such. So when applying different technologies and combining them to one system, it becomes more powerful and more effective. So we need to think also in terms of usability, that what's actually the way of combining technologies to support the process rather than like one item or action itself. But then maybe also here, digital care pathways, this is something emerging and I think in Finland at least we have one on diabetes care. So that's quite interesting, a structured way to help also people from distance be more empowered in a structured plan for their care in long-term care, and helps the nurses to coordinate the different professionals alongside the care process. So very many interesting things already in use and also being developed and applied, and the research evidence on the effectiveness is growing, but still we definitely need more of this kind of research. Okay, so here we go. Okay, in terms of challenges related to these digital innovations, so of course it depends on the innovation itself, but technological readiness and technology readiness, the systems across are different. So we have some places who are more equipped than others, so we need to understand the setting where we are working, and sometimes we need to apply more advanced update the technologies and infrastructures that we have. But also we need to ensure that competencies are up to date, competencies of professionals, but also competencies of patients and their families. So these are like key issues, but then there are things related to the technology itself, the costs. Is it like sustainable? How does it look for the implementation part of it? What's the sort of like how do we understand that the technology works? Is it trustworthy? In terms of particular like AI tools, we have a challenge in Europe. We just got the AI Act in terms of like making sure that the technologies that are applied are safe and effective. Medical device regulation, all of these things that manage and regulate what things we can have on the market in itself. But it's a long, very long process. So understand the changing regulatory landscape and how that influences also one of those key things that we need to consider. But maybe one thing which is overlooked currently very often is the environmental sustainability. So this is something that we need more tools to help clinicians and also also users, end users, patients, families understand how to assess the environmental impact and make decisions based on that, so that we can really think that the choices we do are reducing the carbon footprint that we produce in healthcare. So this is an emerging issue which will probably have more acknowledgement in the future, I hope. Okay. And then, sorry, I tend to click twice. Okay, so in terms of what this means for like health professionals and patients and families, we need to ensure that we have enough competencies. And how do we do that? So we need some type of requirements for different levels and roles. I was talking about different roles in healthcare organization to ensure that the technologies that we apply are appropriate and safe to use. So we need to have that expertise all over. But maybe bedside, I think it's important to think about like what's a sufficient level of understanding related to these technologies, like for the users, the nurses who teach patients and who educate families about how to use these technologies and such. So we definitely need more work on that, and there will be differences between entry-level clinicians and advanced practice clinicians, but at least this is something that we need to consider in the curriculum development. Also to consider that this is a continuously evolving this field, rapidly evolving as well. So it's sort of moving target. So we need to update these curriculums very often, and ensuring the lifelong learning process with these continuous professional development programs, that we actually make sure that we stay up to date after entering practice. But this interdisciplinary approach is something that I like to highlight often, because like making things together, when I was talking about this platform, for example, the digital health ecosystem, which helps this hormone therapy care processes, that we need to think about interdisciplinary approach when we develop these systems, when we seek for them, and when we apply them into practice, that it needs to a system which is sort of supporting different user needs will be more effective. So we need to have a discussion amongst ourselves to make this these most relevant and impactful technologies developed and also applied. Okay. And then to my last slide, if I'm able. Yes, here we go. So some take-home messages. So these digital innovations and digitalization itself, technology has revolutionized healthcare. We are providing tools which are able to support and empower healthcare professionals, patients, and their families as well. And there are ample opportunities. We need clinicians to help guide the development of these. What is actually needed? Where does it fit in, and how should it be developed so that it transforms practice in a smart way and doesn't increase the workload, for example. So there's also a need to collaborate between different actors in the healthcare organization. So clinical people, clinicians, they need support from leadership to be able to stay up to date with their competencies, but they also need the support to be able to engage with technology development, for example. And then like the final comment relates to competencies and some work that we need to do around this. We need to revisit our curriculum to be able to provide sufficient education for different actors and different settings. And with this, I would like to conclude my talk, and I hope you have found this useful. Thank you.